Visually and mobility impaired individuals. Presented to you by Stephen Ashby, Ashley Bell, Anna Benson, and Carrie Bosworth. Health concerns. People who struggle with visual impairment or mobility impairment have health concerns above and beyond what health concerns most people have. Along with their impairment comes economic challenges due to the cost of treating their impairment. They may have physical barriers that make traveling or transportation difficult. Their impairment can be emotionally tolling and challenging. Their caregivers or family may have burnout as this can be a difficult and trying thing to deal with and take care of. Caregivers or parents of a disabled or impaired child may experience a lot of psychological distress. When we see images or stories that are portrayed in the media, we rarely see disabled people. When people with disabilities are covered or featured, they are usually misrepresented and have a negative connotation or stereotype associated with their disability. The media often does not give an accurate or true representation of their circumstances. Sometimes these people are seen as objects of pity, and other times they are like superheroes who inspire the non-disabled people. This misinterpretation only leads to further misunderstanding of these people by our society. Individuals who suffer from an impairment or disability benefit greatly from having the support of their family. Often this is where financial, emotional, and even physical needs are met. The family can help pay medical bills, take care of the individual, get the supplies that they need, and arrange for their transportation needs. If an individual does not have family support, they may not have these same resources. Not only is it important for impaired individuals to have family support, but their family may need support as well. Being a caregiver for an impaired individual is strenuous and stressful. The families and parents of these disabled individuals will also need support. Children or individuals who have a disability benefit from interacting with their peers. While these disabled individuals may not want to or know how to initiate the interaction, they benefit greatly from it. This means that individuals should seek how to positively and actively interact with their disabled peers. These interactions helps to support the disabled individual's social skills. It also allows people to learn how to have better attitudes toward disabled people. Studies have shown that children who interact with disabled people more often have a better attitude toward disabled people overall. Vision, mobility, and hearing disabilities all have the potential of being passed along to future generations, thus passing along vulnerability. For vision, retinal degeneration or optic atrophy and malformations can be hereditary. With mobility disabilities, there are several diseases that can be hereditary, one being Duchenne muscular dystrophy. As far as hearing goes, there can be a genetic factor, but environmental factors also play a big role. Luckily, the legal and political system has made many strides in the right direction as far as protecting and helping those with disabilities goes. It is mostly helpful to this population as it has created laws that protect these individuals as well as help them. On a local level, I could not find any specific laws that were only on the local level. On the statewide level, there is the Utah Anti-Discrimination Act. This act prohibits employment practices that discriminate against an otherwise qualified individual based on disability. Lastly, on a national government level, there is the Americans with Disabilities Act. The Americans with Disabilities Act gives civil rights protections to individuals with disabilities that are like those provided to individuals on the basis of race, sex, national origin, and religion. It guarantees equal opportunity for individuals with disabilities in employment, public accommodations, transportation, state and local government services, and telecommunications. This list is not a fully inclusive list, but it gives examples from each of the different levels of government how those with disabilities are helped in the U.S. by the legal political system. How does the cultural environment create potential barriers? For those with disabilities, depending on where they live, they may face the issue of their community not being educated. Many places in the world, including third world countries, do not have access to education on disabilities. Therefore, they are likely to determine incorrect stereotypes and beliefs about those with disabilities due to lack of knowledge. Next, unfortunately, our society still has problems with viewing people with disabilities as different. While they may indeed have differences from the majority of the population, this marker of difference may create issues. Stigmatizing qualities such as physical or intellectual disabilities attract the attention of non-disabled persons, often triggering prejudicial thoughts and attitudes, and on occasion discriminatory behaviors. So let's look at the cultural environment on an international scope for those with disabilities. While our world has come a long way with accepting and helping those with disabilities, there are still places where people with disabilities are treated very poorly and or have significant disadvantages. Some examples of these places include Ghana and Latin America. In Ghana, those with disabilities continue to be discriminated and socially excluded. People in Ghana generally believe that disabilities come from a spiritual sickness and do not want to associate themselves with the disabled because of this cultural belief. In Latin America, many children with disabilities are not being educated. Only 20 to 30% of children are receiving education. While in Ghana and Latin America are a couple of examples of places that treat those with disabilities very unfortunately. Sadly, people with disabilities still face many challenges with equality and discrimination no matter where they live. The United Nations Special Reporter of the Human Rights Council has pointed out that people with disabilities are also more likely to experience poverty and social exclusion and less likely to be employed, receive an education, or gain access to public services. They are more likely to be the victims of violence and contract HIV and AIDS. Socioeconomic status can correlate to quality of healthcare individuals with visual and mobility disabilities have access to. Individuals with disabilities are less likely to graduate from high school and receive vocational training, putting them at risk for less employment opportunities, unequal pay, and discriminatory work. Rates of poverty are higher for individuals with disabilities. This puts them at risk for poorer health outcomes. There is a profound difference of health outcomes for people with disabilities depending on their race and ethnicity. According to American Association on Health and Disability, whites with Down syndrome in the United States had a median death age of 50 in 1997, while the median age was 25 for blacks and only 11 for people of other races. Individuals with mobility limitations and in a minority had worsening health, depressive symptoms, diabetes, stroke, visual impairment, difficulty with activities of daily living, obesity, physical activity, and low workforce participation. Religious groups can offer support and spiritual care to disabled individuals. The challenge would be transportation to the meeting house or accessibility. Churches can have low lighting that would present a challenge to visually impaired individuals. Not all meeting houses make it easy for individuals with physical limitations to safely get to church. The church does not provide community support and inclusion. Mobility and visual limitations present challenges for receiving health care. Individuals with disabilities are less likely than their counterpart with disabilities to get preventative health care. Women have slightly high incidences of disabilities than men. Members of vulnerable populations experience increased disparities when living in rural areas. This is because there's limited access to healthcare services in these areas and increased risk factors of living in rural areas. Because of this, health outcomes are adversely affected. Telehealth can provide improved access to care and is an affordable resource. Rural Health Information Hub states, telehealth allows specialists and subspecialists to visit rural patients virtually, improving access as well as making a wider range of healthcare services available to rural communities via telemedicine. Health disparities are increased for individuals with visual impairments, mobility impairments, and other disabilities. Biases and even discrimination can cause further disparities, which worsens health outcomes for this population. Health disparities are often complex and interrelated. In areas where there are fewer health disparities, those who are visually impaired, mobility impaired, rely on others to provide their cares, may experience improved health outcomes. There are visually impaired, mobility impaired adults and those who depend on full-time caregivers worldwide. And many of the biases and disparities are the same between geographical locations. Certain factors, such as lower income levels, less access to proper health care, education, and social determinants can increase these disparities.